Hi, I'm Dr. Craig Anderson. Today I'd like to talk about headaches that come from your neck. These headaches are called cervicogenic headaches, essentially meaning that they've come from the cervical spine, which is the top 7 vertebrae of your spine, from C1 down to C7. Now you know you have a cervicogenic headache if the headache tends to start in this area, feels like there's pressure back there, and then it works its way over to the front of your head. This typically is cervicogenic, meaning the genesis of the headache is from the neck. Now, what's the difference between this headache and a migraine, for example? Well, a cervicogenic headache can generate a lot of pain. A migraine typically generates more pain. And there's another feature of a migraine, that is you're photophobic. You're scared of the light. You don't like light. You want to shut things down. You want to get into a quiet room and just check out for a couple days. Chiropractic care can benefit cervicogenic headaches because if it's coming from the neck, then there's often a movement problem in the neck. Here's the cervical spine from the side view. This would be the front, this would be the back. A normal neck has a curve, like you see here. This curve works as a shock absorber. It absorbs the shock and the force from your head. If you have flattening of that neck curve, then you're going to lose that ability to absorb shock, and you're going to transfer that force right up to the base of the skull. That's going to put a lot of force on these muscles and really fatigue those muscles out, get them very tired and start to generate pain from this area. It's going to work over the head and come over to the forehead. These kind of headaches respond very well to chiropractic care. A migraine, on the other hand, can respond very well, but there's often specifics that we have to look at outside of the neck, such as diet. We have to look at the person's environment, history, even medication use. Adverse effects from medications, toxicity in the bodies, all these have to be looked at. So when a patient comes to the office and they have a headache, first we have to determine if it's a headache that comes from the neck or if it's more of a migraine headache, and then that would direct our course of treatment. So if you have a cervicogenic headache, if you have a headache that has come and gone off and on for months or maybe even years, you need to get that evaluated. You need to get a very specific diagnosis. Is it a headache from your neck, or is it a headache from some other source? Maybe a migraine, maybe toxicity, or maybe you're just tired, fatigued all the time. Here at Back Experts, we can help determine what kind of headache that is, and if it's something that we can treat, we're more than happy to discuss that with you. If you'd like more information about headaches, you can go to backexperts.com and simply type headaches into the search bar. You'll get more information, some research, some articles that I've written, also discussions. And if you can do me a favor and fast forward this video to someone who may have a headache, chiropractic care may be the answer to their problem. For now, have a good day and make some healthy choices. Thanks.